I wanted to answer a quick question. Renee had a question. She's like, "Hey Doc, I noticed that you went straight to zirconia in less than 48 hours, and is this something new that you're offering?" And I kind of wanted to explain why I did it, and moving forward, is it going to be an option? So I'm a big proponent of making sure that the devices are made just perfectly. And most of the time, I think it's hard to pull off something like this in 24 hours and give someone truly quality teeth. But in his case, just kind of understand why we went to zirconia immediately. All-on-4 is a process where we take out someone's teeth, or if they're in a denture, we put 4 implants on the top, 4 on the bottom. In his case, we actually put 6 on the top, 4 on the bottom. And what we end up doing is we gave him an immediate zirconia device, and that was 48 hours. So normally it's 24 hours, and I'll give him a composite bridge. But the reason why truly I gave him zirconia was we were having issues with my machine. And so this is my printer, and if the printer isn't working, you got to come up with other solutions. And I felt pretty confident with Robert because of his history with me. I actually did his wife's teeth a couple years ago, and when you're making the teeth yourself, that's huge. I don't know if I've talked about this as much recently, but I'm standing here in my lab right now. If you look here, we got milling machines. We have I paint, I color, for lack of a better term. I add all the ceramic, the porcelain onto my monolithic zirconias, but I'm doing the milling, I'm doing the designing. And so when you have complete control, I think you're probably in the best scenario to be able to pull something like this off. But you'll notice that, I didn't tell him that these were his definitive teeth. They could be. The hard thing to know is that what will his gums look like in 4 to 6 months. What I did differently in his case is that I reached out to him the night of the surgery. Said, "Hey, I'm having some issues with my machine, so I want to, if you can give me an extra day." And so instead of him getting teeth the very next day, I basically started the process of milling out his teeth. And so let me kind of show you what that process looks like. So you start over here, and it's like a bomb went off my office right now, but let me kind of give you an idea if you guys want to see. Like, it's a process. Let me pull up my computer here so you can see. Give me 1 second. Because if you first start off with the design comes after surgery. And so you look here, like this is the software where I will design teeth. This is kind of what his scans look like the day of surgery. And you put this together. And this is the process where you start to design his teeth. And so from here, once his teeth are designed, and I'll go so far, let me actually just pull up what his design actually looked like. Maybe you guys might like that. Hold out here for a second. I'm on the fly right now, guys. But so the software I use is Exocad. That's pretty standard with most offices or most designing. So here's my milling folder. So let me show you. Open. Okay, so let me see if I can turn this around here. So this is the design. Okay, so I basically designed this. Those aren't obviously in occlusion, but they're designed here. And then from here, in this software, it goes into a milling machine, and it's milled out here. And to give you an idea of kind of what, again, these are kind of like the different. So you start off with a disc here, and it starts to mill, and literally, so this is what it looks like at the beginning. Then it starts to mill, and as it mills, it cuts out the teeth. This is zirconia, you can kind of see the process here. And it keeps going until it gets to a point where now it's two different pieces, where you have a monolithic zirconia, and then you cut it out. You can see this is another one that's cut out. And then you take it, and like, for example, like, see how bulky this is? This is one that was designed like years ago, and it was horrible, and I just didn't use it. This is also defective, but let's say this was right. You bring it over here, you'd polish this up. You would basically make, see how like there's, this one here has a little bit of blemishes. You can see where it was attached. You kind of smooth it down. Then you come over and you stick it in a furnace here. And this furnace is gonna bake for like 14 hours, 14 hours. And then it comes out, and when it comes out, it's gonna look like this here. It's gonna come out and it's gonna look all white, right? It goes from this chalky look, and it's kind of big and bulky, to here, right? And then you start to paint it. And so you can see like these are different, I say paint, but you're adding a certain type of ceramic, a liquid ceramic over top. So it's monolithic because it's all one piece, versus polyolithic. Polyolithic would be something like, let me show you, hold on here. Okay, so something like this. This is a titanium bar where it has three different pieces. So you have the titanium, which you can see like that gold part, then the pink acrylic, and then you have these composite teeth on top, okay? So this is all monolithic. It's all cut out. It's like all one piece. Then it goes through this long sintering process, and that's why most offices that do everything in 24 hours, they're going to put a bar underneath it, right? They'll have titanium bar substructure. Like here's a bar here's an example of a bar, a polyolithic device made with a bar. That's what's going to support it. When I was doing bars, my bars look more like this. Check out that. That's the beast. But this is like one that I got from a lab when I wasn't designing myself. This is one I would design. So if I design them, they're going to look a lot bulkier, a lot bigger. But then it goes. So when it comes out and it's, let me grab that piece again. This here. So it comes out, and I take it in here, and excuse the mess. It's been one of those days where it's been kind of crazy. But we basically, you sit it down here, and then we start to paint it, okay? So it looks like this, and then we start to add different colors, right? And this is where the artistry comes in, where a technician's gonna do this. Like this one here is not completely done. You can tell it basically has, has some really, really strong colors in it, but that's in the process. But you can see there's just lots of different colors that we use, and then each time that we add a shade to it, we throw it into a furnace here, and we bake it over and over again, and add, like, for example, one part we'll add just the gums, and then the next part we'll add the shade of the teeth, and then you start to create like a halo effect and the incisal edge here. I just realized I got something in my teeth. That's embarrassing. I had salad. I'm working on my diet, okay, guys? But see, at the end of the day, it's quite a process. And so committing to someone to do zirconia from the beginning in 2 days, that's pretty intense. I had to actually stay pretty late. But I like Robert so much, and he's, like I said, his wife, Hope, was just a sweetheart. I took her through the process. Unfortunately, she passed away this last year, and I grew close with their family, and got the best compliment from her daughter. She said, Doc, my mom, the year and a half, 2 years my mom had her teeth, it was the happiest she'd ever been. And I saw her change, and she said it was worth every penny that last year, because I get so many patients that come in and say, I'm old, it's not worth it, right? And I saw this firsthand with my grandma too. My grandma was well into her 70s when I kind of tricked her into getting all on four. You know, I actually keep my grandma's. She had a denture for 45 years. And I try to keep her dentures here close. See if I have them. I think they're actually on the other side. But I keep them close in my office because it reminds me of where I came from. And my grandma had them for 45 years. She's a stubborn Dutch lady who wouldn't take any handouts. And so I had to kind of trick her into getting teeth because she thought she was coming in for cleaning to clean her dentures. And I kind of darted her in a sense, and I made her, I didn't dart her, but in a sense I said, you know, you look a little bit anxious, Grandma, and so I'm gonna give you something to calm you down and, you know, put her to sleep. And I did have the blessing of my whole family to do this. It was legal, I think, I don't know. But long story short, I ended up, when she woke up, she had 8 implants, you know, 4 on top, 4 on bottom, and something, she wore that denture for 45 years. I was able to give her some teeth, and she, you know, we didn't think she was gonna last more than a couple years. And the cool thing about it is my grandma lasted almost a decade longer. And she attributed a lot of that to the fact that she was, you know, had those teeth. She was so proud. Every time she'd go to Costco, she'd show everyone and say, my grandson made these teeth and stuff. So pretty cool. So to answer your question, Renee, if you're watching this video, zirconia isn't something I do all the time. It's actually the first time I've ever done it straight out. But I do think that it's something, if you have the right person, and if you notice, I said these are permanent teeth, but if we need to make changes, the gums if there's an issue with holes, you know, food getting caught, then we can make you new teeth. And I was willing to take that risk. And so we'll see kind of how it plays out, but I'm really happy. I think they look nice. I think he was very happy about it. And so I think there were some comments. Let's see if I can pull them up. I don't really take questions here. I'm not good at multitasking, talking at the same time. So I don't even know if I can find where they're at. I don't know, I don't see them. So if you have a question, you can ask it again. Oh, hey. Okay, and if anybody else would like to join, please do. I need for patient solutions loans. Yeah, I don't know what that's all about, but at the end of the day, I just wanted to kind of show you one more thing here. I was hoping I could find my grandma's dentures because they mean a lot to me, you know. And I keep them close. I actually had them just cleaned, but she's passed away recently, and it's okay. I don't need to show them. If anyone has any other questions, comment here and I'll comment back. But Renee, it was a really nice question. I hope that answers your question. If you have any more, let me know. But long story short, zirconia is the best material out there, and I think monolithic's the way to go. But you have to work with someone that really knows and has confidence. And I think having a doctor that actually, I mean, there's not a lot of us out there that do it all. There's a few that I know of, but not a lot. And I think you get better and better as you start to take, you know, a patient through the process over and over again. So God bless you guys. Hope you have a great weekend, and we'll subscribe. I'm supposed to say that. I don't do that very often, but yeah, thank you, Jenny. Yeah, my grandma, she passed away just a few months ago, but it was a good thing. She was ready to go, but she passed away with a smile on her face, and that's one of the best things, best experience ever. When a doctor does this on his family, he really believes in it. I've done this on my grandma. I talked about it. My mother-in-law. Now that could be questionable, right? But my father, who is my hero, I also did all on 4 on. And so I do believe in it, and I think that's important to believe in what you do. But have a great weekend. Thanks for the nice comments, Jenny, and I'll talk to you guys later.